I think it goes without saying that COVID was the challenge of a lifetime for many of the folks in the healthcare world, and Massachusetts weathered the past 2 years better than most, thanks in large part to our world-renowned healthcare system and the incredible healthcare workers who care for our patients every single day. From hospitals to community health centers to long-term care facilities and everywhere in between, healthcare workers across the system stepped up and responded to an unprecedented set of challenges. But the pandemic also cast light on some of the underlying structural problems that we identified in that legislation we filed back in 2019 that still need to be addressed. The legislation we're filing today aims to address those challenges through 3 major areas of attack. First, to promote greater investments in and access to behavioral health and primary health care services. Second, to control the factors that drive up healthcare costs. And third, to improve access to high-quality, coordinated care, especially for people in Massachusetts who are dealing with multiple issues and comorbidities. We're here today at Cobham Square to highlight their strong primary care and behavioral health care services and to talk about ways that our health care bill increases investments and access to primary care and behavioral health care. For several years now, there's been a consensus that we should be prioritizing mental health and treating it the same way we treat other types of medical care. And there's broad agreement in the healthcare community and among our colleagues in the legislature that we should and do need to make that happen. Our 2019 bill aimed squarely at addressing that issue. And since then, the pandemic has only underscored the need to treat behavioral health care services the same way we treat other health care services, both in terms of people's ability to access those services, but more importantly, to put them on a level playing field with respect to how and what we pay for them. As we emerge from this pandemic, we all know that too many people, young and old, are struggling with feelings of isolation, depression, and despair. And too often, it's difficult and complicated to access services that can help them. The bill we're filing today would require healthcare providers and insurers to increase spending on primary care and behavioral health care within the context of the overall healthcare cost growth benchmark that's set by the Health Policy Commission. The bill sets a target of 30% growth in these areas over the next 3 years, but gives providers and insurers flexibility with respect to how they go about meeting that objective. By increasing investments in this part of the healthcare system, we open access to care and keep people healthier in the long term, make services that are not currently available more available, and also provide a more cost-effective approach to healthcare generally. I'm sure that Kate will talk about the impact that a shortage of community-based behavioral health care services has had on the delivery of services and care overall at Boston Medical Center when she speaks. We're also taking steps to promote behavioral health parity so that insurance treats behavioral health care the same way it treats physical health care. The legislation requires insurers to apply equal rates of reimbursement for certain behavioral health visits, whether provided by primary health care providers or licensed mental health professionals. There are so many issues associated with the difference in the way behavioral health gets treated and traditional health care gets treated that I won't go into all of them today, except to say that some of them we did manage to fix in other bills and other legislation, and in some cases through regulation, but there's still an enormous amount of work that needs to be done here, and this bill aims at getting at many of those current flaws and problems within the current system. Most recently, Secretary Mary Lou Sutters and her team have been working with providers, advocates, and other stakeholders to develop and begin implementing what we've called a roadmap for behavioral health reform, which outlines tangible ways we can increase access to these services. And our fiscal 23 budget, which is currently before the legislature, proposes $116 million in new funding to implement this plan. Among other things, it would create a new centralized staff behavioral health helpline, which would be available 24/7, 365 days a year, to provide live support, clinical assessment, and connection to the right mental health and addiction treatment provider in real time for people seeking services. readily available outpatient evaluation and treatment through primary care, supported by new reimbursement incentives, as well as same-day evaluation and referral to treatment would be available at designated community behavioral health centers throughout the Commonwealth. And better access points for emergency behavioral health support instead of emergency rooms, again, something I'm quite sure Kate can speak to in great detail. The reforms we're filing today will build on that and further promote increased access to behavioral health services and primary care, and we look forward to working with our colleagues in the legislature to finish some of the work we started in 2019 and during the course of the pandemic. We also have additional consumer protections in here that focus on high drug costs and create new accountability measures for drug manufacturers who excessively price or increase the cost of their drugs for consumers. And we also recognize that health insurance costs are increasingly a burden on small businesses and their employees. So we propose several reforms to ensure that the small group market and their workers have access to high-quality, affordable health insurance options as well. Finally, the bill aims to increase access to high-quality coordinated care, and it does this in a variety of ways. For example, the bill increases the scope of practice for certain healthcare professionals and removes red tape in healthcare licensure. These are both issues that we dealt with through emergency orders in the course of the pandemic. They turned out to be enormously effective at providing additional access to care and additional coordination around care. We need legislation to make them permanent. The goal of this is to allow more qualified professionals to provide care to residents while maintaining strenuous requirements to ensure patient safety. And as I said, we saw the benefits of this during the pandemic. I just want to close by saying this. The pandemic demonstrated that while our healthcare system does many things very well, and thankfully we all saw that firsthand every single day, we still have a number of significant issues and problems we need to solve. And the biggest one among many is this whole issue of how we choose to pay for and support primary care and behavioral health services. The comprehensive community-based health services that are provided at a place like Codman Square are a shining example of how these things can work together. And the bill that we're filing today builds on many of those strengths while reorienting the rest of the system to face the new challenges that are required to meet the issues, illnesses, and circumstances that our residents face today. And it does keep a focus on controlling costs and making care more affordable for businesses, families, and individuals alike, in large part by reorienting the system in a way that will align it more effectively with the real illnesses, problems, and circumstances that people today in 2022 face here in the Commonwealth. We look forward to working with our friends and our colleagues in the legislature to make these meaningful reforms state law and anticipate that we can have a very robust and productive discussion on this between now and the end of the session, because basically everybody has acknowledged that, especially when it comes to behavioral health, we have serious problems to solve, a ton of work to do, and plenty of opportunity to get some stuff done.